Hello, I'm Stan Hall. Welcome to this edition of the Gwinnett Sports Commission's Get in the Game. Sports-related concussion is a hot topic in the sports world right now. While most assume that these injuries are football-related, they're actually a problem in many different disciplines of sports. Gwinnett is very fortunate to be the home of the Concussion Institute located at Gwinnett Medical Center in Duluth campus. It's a new program that has risen to regional and national acclaim very quickly. Our guest today is Dr. Marla Shapiro, who is the neuropsychologist with the Institute, and she's going to enlighten us about concussion injuries and their program. Dr. Shapiro, welcome to the show and thanks for being with us today.
Thanks for the opportunity, Stan.
Tell us a little bit about the Concussion Institute. What's the mission there? What is it you guys are doing? And just give our viewers today a little bit of an introduction to the Institute.
Well, when I was recruited by Gwinnett Medical Center back late spring, early summer, the idea at that time was to create truly a state-of-the-art multidisciplinary concussion management program. The sports medicine program at Gwinnett Medical Center had been seeing more and more of these injuries, was certainly getting more attention in the media. They were seeing these kids on the sidelines at their games and wanted to know, what do we do about it? How do we do it right? Went around the country looking at other programs and realized that the best programs, in their opinions, were those that were truly multidisciplinary, where you could bring all kinds of professionals under one roof, really not traditional medicine in that regard, not necessarily an MD running the show, but where you had multiple specialists all on an equal playing field themselves, using a team really to treat a sports-related injury, often the result of team sports.
So the sports medicine unit of the Gwinnett Medical Center is one thing, and you guys are another, but in fact, you're still connected.
We're within, yes.
Okay.
The sports medicine program at Gwinnett Medical Center is probably the biggest in the state of Georgia. They have a tremendous program, and it's really a wonderful model, and one of the things that impressed me so much about the hospital, it's a model of really serving the community and not just focusing on patients coming in the door. So the sports medicine program has a number of physicians, but probably 50 or more full-time athletic trainers that work full-time as hospital employees and local public and private schools and some colleges. And it's their mission to treat a broad range of injuries, including but not limited to concussions, and we are one unit within the sports medicine program.
Dr. Shapiro, you and I were talking before we started taping the show today. I come from an era where, and I played sports in high school and was, very average at all of them, but we played them all. But it was a time where you played and you got hurt and you were pushed right back in, and you played and you got hurt and suck it up and go home. When did that start to evolve a little bit where particularly the topic of concussion is concerned?
It's evolved?
I suspect it has. I don't know.
It has and it hasn't. And the culture of sports is truly one of our biggest challenges, is how do we take concussion management and fit into that mold? Because I think there's still a lot of that, frankly, that you suck it up and you play. I have a teenage daughter. When she was learning to play soccer, it's like, look, Mom, I'm bleeding. It showed me how hard she was diving for the ball, and I'm like, that's great, honey. So concussions, we don't manage that way, because we know that concussions, the more you try to push through symptoms, the worse they get because of the nature of what that injury is. And so it creates a need for a very different approach. The idea to manage symptoms so that they don't get worse, so that you get better faster. Concussions, I think you still just see a tremendous amount of variability in the community in terms of understanding, acceptance, speaking to that culture.
Right.
It was probably in the early 90s that professional sports were becoming more aware of this, instituting programs. The neurocognitive testing software that's used most often for baseline testing, post-injury testing, impact, was developed by the medical team working with the Pittsburgh Steelers. And that's where that originated, looking for a better tool for more immediate assessment of the symptoms related to concussion. And over the last few decades, it's getting more prominence, in part because of the attention paid to the professional players and the spotlight that's gotten, but seeing that trickle down to rec leagues and any suburb in the country, that's another story. So we're seeing a lot of variability. Some folks are getting it. Some people see this as a bit of a hysterical overreaction. To me, the key is making sure people understand, yes, this is important. Let's not overreact. Let's not throw out the baby with the bathwater and get rid of contact sports altogether. So where did the culture change? Some places it hasn't, some places, I think most places, it's an ongoing and evolving process.
Well, and you make a good point with the NFL being sort of the ringleader here as far as getting this message out, because I bet there's still some reluctance on the part of the athlete themselves, even if they suspect something's going on and they may have injury, based on pride, based on their place on the team, I bet they're still reluctant to make people aware of that.
Absolutely. I think pride placed on the team, fear, especially professional sports, of being labeled as concussion prone. You know, I haven't worked with professional football, but I've worked with Major League Soccer, men's soccer, women's soccer, NHL, and I've been very lucky to work with teams, coaches, physicians that have really understood this. But that's where I think education is so important, because I truly believe that if this injury is managed right, it should not preclude you from going back to the sports you love. It should not necessarily bring with it the host of long-term catastrophic difficulties we're reading about in the press.
Right.
But athletes, coaches don't always know that. And so education opportunities like this in particular are so important, in my opinion, to address some of those concerns and in a lot of cases, irrational fears.
Well, and I would even think in that same vein that the coaches might be a little bit of a stumbling block because they realize if that person truly is diagnosed as having a concussion injury of some sort, they're going to be without that player for a while. Have you had any experience at all with that? So.
Yes, and again, education is key. And I really can't blame coaches, because they're hearing all this hysteria. And if you listen to sports talk radio, you hear about doctors and athletes saying, oh, I wouldn't let my kid play football, which, in my personal professional opinion, I think is an overreaction. So I can't blame coaches for being skeptical. But I also think helping coaches understand what the injury is, why it's in their teams and their athletes' best interest to get off the field quickly is so important. You know, concussion is caused by a bumper blow, usually directly to the head, but not always. That's hard enough to disrupt the metabolic functioning of the brain. So it creates a fuel crisis in the brain. You know, the chemicals that typically fuel the brain, it needs even more of to heal. Blood flow is even altered a bit. So part of what I make coaches understand is, first of all, your kid's playing on less than a full tank. You know, if you think about what kinds of problems concussions can cause. If your brain's a little fuel starved, it's not working as efficiently. Your reaction time's off, your attention's off. Your kid's supposed to drop back for the pass. They're not going to be there as quickly. They may misjudge the distance because of how their brain's working. So one of the things we want coaches to understand is they're not getting the athlete they think they're getting, first of all.
Right.
Second of all, you make a brain that's fuel starved work harder, you're going to hurt worse. The worse you feel, the longer you're going to be out. So the other thing we let coaches know is if the faster we can get your kid off, the faster we can get them back. It's all about protecting the safety of the athletes, but also helping the team too. And so it's helping to understand what understanding what coaches' concerns are and addressing those in the context of injury management, I think is so important, but they don't always hear that.
Well, let's talk about two things. Number one, and we made mention of the fact in the opening today that people do commonly equate concussion with football. But it is certainly across the board. Talk about some of the other sports.
Absolutely. Soccer, high rate of concussion. In fact, the prevalence of concussion in girls soccer, is probably second or third only to football.
Well, the banging of the heads would be without a helmet.
Well, but people assume, it's the heading. I know heading's a problem, but it's not the heading. It's when you go up for a header and there's another head there. It's diving for the ball and hitting, elbows, knees, goalposts, grounds. It's those kinds of things that come with good aggressive soccer play that are more likely to cause concussions. And girls, a lot of theories about why girls may be more vulnerable. They don't have the neck strength, the upper body strength necessarily to absorb the blow, perhaps the way a boy would. But soccer, wrestling, basketball, cheerleading, we see an awful lot of cheerleaders. And what's particularly challenging about something like cheerleading is it's not like the leg's broken and they have to be on the floor. So girls get back because they feel tremendous pressure because they know they're going to be tossed out, especially if it's competitive cheer. But think about it, if you are the flyer and you're being tossed up and you're dizzy and foggy, you're putting not only yourself but your teammates at great risk of injury, and they don't always know that.
Yeah. Well, let's talk about concussion specifically now. As far as I don't even know, and I've had many conversations with many different people about concussion. Right. I'm still not sure I know what the actual definition is. Also, when you start talking about a concussion, symptom-related issues. So tell me a little bit about that, just to bring us all up to date a little bit.
And you're not the only one that has some questions. When you asked earlier about when did this start becoming something, I should know the date. I can't remember off the top of my head, but 80s, 90s, a lot of folks started to gather on an international stage, really, and talking about what is concussion, how do we manage it, FIFA, International Rugby Union, NFL, but also folks working with a variety of ages of athletes, so youth sports as well. The most recent meeting international meeting on concussion in sport was in 2012 in Zurich. And one of the things this consensus group did was come up with commonly agreed upon definitions of concussion, because they have varied so much over the years. And in simple terms, it's really just a metabolic injury that's caused by a bump or blow, usually directly to the head, but not always, that's hard enough to disrupt the metabolic functioning of the brain. It's considered a complex physiological process, a metabolic process. So a CAT scan, MRI, they're not going to diagnose a concussion. They're going to diagnose the more serious stuff, like a bruise or a bleed. And a lot of kids, we ask every kid that comes in our clinic, tell me what you think of concussion is, because a lot of them have seen pediatricians, they've been to emergency rooms, and of the 500 plus folks that have come through our doors, not a single one's ever told me. They all say something happens when the brain jiggles, but most of them say it's a bruise, because that's an easy explanation to a kid, your brain's bruised. But it's not very helpful to them in understanding why certain things make them feel bad. So, it disrupts the metabolic functioning that is the brain's fuel. If your brain's running on fumes or it doesn't have enough fuel, you're going to feel worse. And that causes the physical, the cognitive, the emotional symptoms that we associate with concussion. Physical symptoms being nausea, vomiting, dizziness, sensitivity to lights or noise, which is a surprise to a lot of people, headache, sleep-related issues, being too sleepy, sleeping more, sleeping less, trouble falling asleep, just a disruption in some way. Emotional symptoms, irritability, sadness, nervousness, and parents will laugh and say, well, my teenager's always cranky. Well, sometimes it's hard for parents to say, what's my kid's typical squirreliness versus concussion? But we see more of that with a concussion. Sometimes just because they're mad because they're hurt, but also it's the same brain. But what they'll report in school more commonly are problems with concentration, memory, fogginess, feeling like they're moving more slowly, or sometimes they'll say, I just don't feel right. Yeah, and there's necessarily not any rhyme or reason as to what symptoms you experience when. One of the things I didn't mention was vision issues, either blurry vision, double vision, seeing spots or stars. Well, vision centers are in the back of your head. So you hit the back of your head or the front hard enough and your brain's jiggling around in there, you can actually trigger some visual sensations because of that movement. But it's not like you get hit in this part of your brain, you have this or that. It's, we just see this host of symptoms. Old wives' tale used to be, you got to have a memory loss to have a concussion. You got to pass out or black out. Not true. Most of the people that we see don't have a memory loss. A lot of kids complain about headaches. Well, sure, you hit your head hard, but sensitivity to light and noise is an issue for a lot, and especially when you think about the wonderful technology in our schools and all the smart boards and whiteboards, that alone can worsen symptoms.
Now, I heard an interview you did the other day about sports concussion, and the interviewer asked you the question. They'd always heard that if you have a concussion, you can't go to sleep. You know what? And I hadn't thought about that, but I've always heard that. Is that true or not true?
It's not. I mean, now, if I was a mom, my kid was concussed, would I follow my own advice? Probably not. Because the fear is, what if it's a bleed or a bruise? And something like that can get worse. And so the fear is, how do you know that they're asleep and not unconscious?
Exactly.
And so that's, but is it really necessary with a concussion? Absolutely not. If you have a legitimate fear that it could be a bleed rather than a concussion, then it might make sense. So when folks go, there's no need to go to an emergency room if a concussion is expected. Though on our website and all the materials we hand out, there are certain red flags. CDC has materials as well. They're all saying the same thing. If you see certain red flags, you do want to go to an emergency room, call 911, because it could suggest that kind of more serious injury. Things like vomiting, slurred speech, increasingly frequent headaches, things like that, that if there's a suspicion of a bleed, they might give you that kind of advice. But if it's just a plain old concussion, your kid's not feeling great, they seem pretty stable, is there any need to wake them every 4 hours? No.
One of the things you also mentioned about the NFL is that some of the players who are coming out now as advocates of more intense, at least a more intense look at the whole concussion situation, talked about having, I think I've had 10 or 15 concussions, which is remarkable in itself. But is there any correlation, or has any correlation been deemed as far as concussion and long-term side effects such as dementia, Alzheimer's, Is there a correlation there?
You know, it's messy research because especially when you're looking back, trying to piece together histories and rely on the memories of folks that may be a little questionable to begin with, it is hard. You know, the wonderful work that's being done up in Boston with Bob Cantu, that Chris Nowinski was so instrumental in getting started, look the brain banks and looking at these tissues, there's a lot of hypotheses about repeated concussions and what that's doing to create these dementia-like processes. But why does it happen only to some athletes and not others? There's a lot we don't know. There is a fair amount of research that shows that if you've had one concussion, you are much more likely to have more, and the more you have, the more vulnerable you are to these long-term problems. But one of the messy problems with that research is we don't know how many of those folks in those studies were 100% recovered before they return to sport. Exactly. And so that, to me, is really the key thing. You know, people, you know, we see kids in our clinic that are told, oh, 4 concussions, you're out of sports, or your brain needs to rest. Well, there's no scientific basis for that, and there is no magic number. We know that there are risk factors for more severe symptoms or more prolonged recoveries, things like migraine histories in yourself or a family, pre-injury histories of attention problems, learning problems, family history of Alzheimer's seems to be a risk. We don't exactly know why yet, but so there are a number of risk factors. But you know, generally speaking, I look at how long does it take somebody to recover if well managed, and that if well managed being particularly important. If we're doing everything they can, they're following good medical advice, and it seems to take them longer and longer to get better, less and less of a hit to feel concussed, symptoms last longer, then we start to wonder and worry. But especially at a youth level, I really don't see that as terribly relevant, but I think those are the sorts of questions they're really struggling with, particularly these adult athletes.
Yeah, because, you know, just as that's the story that gets the headline, the pro football player who is now having severe memory loss and even much worse in some cases. But there's plenty of athletes who have had concussion incidents where there's no long-term effects associated with it at all, right?
Not only that, we see a number of kids, you know, what I call the refugees, that have been managed perhaps, or seen folks in other places, come to us 14 months maybe after the injury, and they're being told post-concussive syndrome, you'll never play, whatever. And invariably these are kids where there were things that were missed. You know, we know that the vestibular system, how your eyes, ears, your balance system, all these senses work together to figure out where you are in space, the things that cause vertigo. Right. You get hit hard enough, that system's whacked. Most athletes, that seems to recover pretty spontaneously, but as part of our multidisciplinary team and screening, we look for balance, eye tracking, vestibular issues, and invariably these athletes that have just gone through purgatory for 14 months are kids for whom those deficits have persisted and nobody's picked up on it. Yeah. You know, so we're seeing a lot of these long-term complications, not so much, in my opinion, due to the injury itself, but due to how it was or wasn't managed and things that were missed. And that's why it was so exciting to me to come to a program like this. When I was working in suburban Maryland in my own private practice, if I wanted a neurologist, I sent him to Baltimore. If I wanted PT or had a complex case, I sent him to Pittsburgh. We didn't have the resources to really manage all aspects of the injury. And as a neuropsychologist, yeah, I know a lot about a lot of things, but not everything, and I can't do it all myself. And so having these resources literally in the office.
One-stop shopping almost.
And it's so nice for our patients, because when you're a busy working parent worried about your kid, or a kid who just feels lousy, do you really want to be driving hither and yon and having, well, wait a minute, I didn't get that file, tell me again? Not, you know, it's just, we can do it all right there. And these are such individualized injuries too. We can truly individualize care because we're all there doing it together.
Yeah. We're going to take a break. When we come back, I want to get you, if you would, just to give us a little bit of a walkthrough of what a kid would expect, or not a kid, but an athlete or whoever might expect if they came based on suspicion of a concussion or whatever. We're talking today with Dr. Marla Shapiro of the Concussion Institute at Gwinnett Medical Center. We're going to take a short break. Stay with us. We'll be right back after these messages.
Getting closer to nature can get you closer to your family. Go to discovertheforest.org.
A full life, measured in seats, starts with the right ones early on. Car crashes are a leading killer of children 1 to 13. Learn how to prevent deaths and injuries by using the right car seat for your child's age and size.
Welcome back to the show. We're talking today with Dr. Marla Shapiro of the Concussion Institute, which is associated with the Gwinnett Medical Center. And Dr. Shapiro, before the break, we talked a little bit about the whole concussion premise, all the things that go into it. One of the things that I think people who are watching the show today, and certainly myself, is most familiar with is this, the baseline testing you do. First of all, tell our viewers what that is and how it's applicable to the concussion study, if you don't mind.
This is probably one of the biggest ways that Gwinnett Medical Center first got involved in concussion management long before I came in. For about 5-6 years, they've been administering preseason baseline tests to Gwinnett County students free of charge as part of the athletics department in Gwinnett County Public Schools. And it's the test that they're using, Impact, is a computerized test of skills that are most sensitive to concussion. So things like verbal and visual memory, reaction time, and processing speed. This was the tool that was developed by the medical team working with the Pittsburgh Steelers some years ago, and it's trickled down to high school youth athletes. There's been development of a pediatric version, a lot of competition popping up. And the idea is you take a test of skills that are fairly sensitive, you develop multiple alternative forms that are fairly comparable in terms of difficulty. You give it to a student or any athlete pre-season so you get a sense of what their true levels of functioning are. God forbid they sustain a concussion, you have something to compare to help you in the decision of when are they sufficiently recovered. It's a great idea in a lot of ways. You know, these tests are developed with normative data so that you give me a 15-year-old girl with a concussion, I can tell you what an average girl that age, with or without a concussion should look like on those tests. But how many of our kids, especially in Gwinnett County Public Schools, are average? You have kids who are smarter than average, probably maybe not as intelligent, or that have attention issues or sleep deprived, all kinds of things that interfere with effective functioning in those kinds of domains. And so the more accurate your knowledge of what they are supposed to look like without a concussion, the better able we can be to determine when they've recovered. It's a wonderful idea. To me, one of the best parts about that, frankly, is the opportunity to educate kids in putting that testing in a context. You need to make sure the test is done right. We know of situations where folks have been taking the baseline test at home, which to me is not necessarily the best environment for getting the best estimate of a kid's attention span, so to speak. So you want to pay particular attention to testing conditions. There are a lot of guidelines that come with the test in terms of how to optimally administer it. You don't need to be a psychologist to administer the test, but you do need a psychologist involved to know what are ideal testing conditions, to look at the data, to make sure it's valid, and to also interpret it in the context of a student's typical academic functioning, because it'll give you scores of what percentile. You did better than 90% of kids your age. But we often hear from kids, well, my doctor said I passed the test. There's no such thing as a passing score. You may look as good as you did at baseline, but if you are an exceptional student and your baseline scores only showed low average to average functioning, yeah, you may have passed it or done just as well, but I'm not convinced it was good in the first place. So it's a simple theory, and it's a wonderful tool for education and getting more data to help decide when it's safe to return someone to play, but it's certainly not the only thing that we can do, and there are a number of different models for preseason assessment, post-injury assessment that we are looking at from a research perspective, but also in making sure we have the best tools to return athletes.
So it's not an exact science based on environmental conditions that can skew the results.
Absolutely, and I'm really glad you brought that up, because people aren't always aware of that. Because like I said, you don't have to be a psychologist to administer it, and that's been something of a surprise to parents too, because like I said, you get these normative scores, so you would think, well, anybody can read that, but as a psychologist, I know testing. It's just what I do. So I'm looking at a lot of different things under the hood, so to speak, and in the context of that individual. The other thing I want to mention too, Stan, is as important as that is, it is only one piece of what we do and what we use in determining how severe the injury is or when someone's recovered. I've seen it read that neuropsychological assessment is the cornerstone of concussion management, but it should never, ever be the sole or the primary basis for determining when someone's ready to return to play. We use neurocognitive testing, we use athlete and parent symptom report, we do physical exam looking at balance and eye tracking, and we also look at what symptoms are reported as someone returns to sport. all of them together to decide when someone goes back. It's definitely, there's a lot of subjectivity there.
Okay. So let's go through a typical case. Let's just say, for example, today, my daughter, who was a soccer player, you know, she had some incident on the field where she took a lick to the head and she's feeling a little funky, and I decided to bring her in. What could a parent or a child or an athlete, whoever, what would they expect when they came to the concussion?
Great question. Well, we get referrals in a number of different ways. Some of them come from just community referrals, pediatricians, emergency departments, et cetera. But some of them come from our own athletic trainers. Most of the Gwinnett County public schools and some other private schools, some schools outside Gwinnett County, have Gwinnett Medical Center certified athletic trainers in their schools. Right. So we've worked with our sports medicine program to develop a sideline assessment protocol that our athletic trainers will administer to determine the severity of the injury. I don't think we need to see every kid with a concussion. So we have some guidelines in place. If it's a fairly mild injury, if the athlete feels they're 85 to 90% of themselves within a couple, within a day or two, if it's fairly mild, we'll work with and provide ongoing consultations to the athletic trainer to manage that injury in the school to minimize the disruption to the student, the parent, because we also still work with school personnel to manage the academic side. But if the child's injury is more severe, if their history is more complex, or the parents just want to come and see us, they'll come in our door. We try to make the appointment as efficient and thorough as we can. We see kids on time, because the last thing a concussed kid needs to be doing is killing time in a waiting room, waiting for the busy doctor. We have parents fill out some written information to bring in with us. We want to know, again, the context of the injury. We get a screening on social emotional factors, academic history, we get their school schedule, that sort of thing. They'll come in, they'll spend the first half hour of their appointment with myself or my other neuropsychologist, Dr. Adam Shunk, who's joined us in the last month. They'll have an athletic trainer who's there for the entire appointment, who's there as their case manager. They'll be assisting Dr. Shunk or myself. They'll also be assessing the physical pieces, looking at neurobehavioral functioning, reflexes, eye tracking, balance, that sort of thing. They'll help us decide if we maybe need to do some neurocognitive testing. They'll help administer that. If someone's feeling pretty good and they're itching to get back to play, we may put them in our, the treadmill, the bike. We have the exercise equipment there to see, can they tolerate some activity? Because again, we want to get kids back to their lives as quickly as possible, but as safely as possible. We also are very fortunate to have a full-time education coordinator, Maria Chininis, who's a 30-plus year veteran of the Gwinnett County Public School System, who is there solely to work with us and families and liaison with schools. So families are in there for about 2 hours, and we spend a lot of that time educating and helping kids in particular to understand how to manage that injury. We see a lot of, one-size-fits-all sorts of concussion management guidelines that say, take away electronics, sit in a dark room, stuff like that. You have teenagers, you take away their electronics, you're cutting the umbilical cord. I believe in setting firm limits and helping kids, athletes of all ages get better, but they have to understand their injury and what to do and what not to do. The idea is to minimize demands, academic, cognitive, physical, what have you, so that they actually finish one day not feeling any worse at any point. Odds are good if that happens, they're going to feel better the next day. So there's a big educational emphasis in that 2 hours there in our office on helping them to understand how to manage their own injury. We'll also communicate directly with the schools, talking about we need to do this for language arts, we need to do that for science. Student athletes will leave our office with a written game plan for their physician, their team doctor, primary care physician, school, whomever they're working with, because we do want to approach this as a team, not just the team in our office, but their community-based team, and give them individualized guidance on how that athlete needs it managed. This student at this school with this course load is going to need some different accommodations from this kid. These teachers may be willing to drop assignments, these may not. So we really try to individualize and manage stress and do whatever we can working with their own team. We don't have any set rules of thumb for you must come back every so often. We try to find that balance between often enough so that we can keep tabs on you, but not so often that it's creating more symptoms and distress in and of itself. If, and depending on the point of the injury, if they're still having significant vestibular, eye tracking, balance problems within a couple weeks with good care, we'll refer to our physical therapist. So that may be part of that appointment process. Dr. Shunk is doing some individual psychotherapy.
Interesting name, by the way, for this particular
Dr. Shunk, yes. So who's an athlete in his own right. He was a Nike All-American track athlete, but he's doing some psychotherapy. We've talked with other folks. So we're trying to really provide everything. pretty streamlined process because we really want to provide individualized care. We pay, it's silly things. We pay attention to the lighting in the office. We really want to not make this any worse for students or their families, but really help them to manage. I mean, as a psychologist and especially a neuropsychologist, my focus, my training is brain-behavior relationships, and that's what a concussion is. It's managing those things and doing it in an individualized way, but minimizing the hassle factor. Part of what we're looking to do more of too, now that we're, getting our protocols established, our staff is growing, is work with more community health care providers, primary care physicians on more of that triage sort of approach. If some pediatricians, they're so busy, they don't want to touch this stuff. Others, they do want to do what they can for their patients. So we want to help them to develop models of how to manage it as effectively as possible in their office and know when to refer to us. We're looking at what I've described as a pretty typical patient appointment. As they recover, they come in for briefer times. They may just see the athletic trainer as we're beginning to return them to sport for supervised exertion. Particularly with spring football season on us, we're looking at clinic models. Can we serve larger numbers of athletes, but also have our sports medicine physicians, maybe a neurologist, a variety of providers, and serve kids even more efficiently and at a more acute level. Sometimes we're fortunate we get kids in our door within the first 72 hours, which I love, because the sooner we can get to them, the sooner we can start to get them better, the sooner we can alert school personnel to manage. Some folks we see 14 months out, but I think generally if we can develop models to serve more athletes and serve them more quickly and more efficiently, that's only good for them.
Well, that's interesting, because I do think one of the scary parts of all this is that even as an adult, when you think about injury, I'm talking about typical traditional injury or sickness or illness, once you realize what it is, you can already start to gather in your mind what your window for recovery is. Yes. But when you talk about concussion, it is very vague, and you really don't know, all right, I've been diagnosed as having a concussion. What does that mean long term? So it is interesting to hear you sort of, work that out on a schedule, how it works. So.
Yeah, I mean, the one thing that I hear so often from parents is, gosh, I wish I knew that. One parent said, well, they called some hotline or something, got some general advice, or another said, well, my pediatrician said not to go to school and not to do sports. It never occurred to them that sitting in the gym for the rest of the basketball tournament could make things worse because of the noise and the lights and things. And so the sooner we can get, what I do isn't necessarily rocket science, but there is a lot of myth and misunderstanding. So the sooner we can get to athletes and parents, the sooner we can educate, the sooner we can get on top of things. Some folks delay because oh my gosh, I can't miss school. The pressures on our kids are so great. But Gwinnett County Public Schools, I'm sure they are quite a leader academically, but in my experience, they are absolutely at the forefront of how schools should manage this right. The collaboration and the cooperation we've seen, not just from the athletic side of the county, but the academic side has been extraordinary, and these teachers have the power and the skills to do whatever they need to do to take that pressure off, to modify assignments, to creatively manage workload, and families don't always know that. So again, the sooner they can come in, the sooner we can reach out and come up with those creative solutions that their teachers are more than willing to do. They just need to know and to get some guidance.
Well, it's a very interesting topic, and it is pleasing for me to hear from you that once again Gwinnett seems to be on the cutting edge, as we like to pride ourselves on most all things, but yes, as it relates to the topic today, it does seem like we really are on the cutting edge. If there's people watching today, Dr. Shapiro, who want more information about the Concussion Institute, how can they find that out?
They can go to the Gwinnett Medical Center website. They can go to gwinnettsportsmed.com/concussions. They can call our Concussion Institute at 678-312-7880 for information about appointments, to get some literature. And we are happy to come out in the community too, to speak to coaches, to teams, to parents. I think that education is absolutely critical, and that's an important part of our hospital's mission too, of course, in serving the community.
Yeah, well, thank you so much for coming today, and we definitely want to have you back as this continues to evolve, which I'm sure it will.
Be my pleasure.
Thank you so much. That's all the time we have today. If you have comments or questions about today's show or ideas for future shows, you can reach us at the email address or the phone number shown at the end of the show. Thanks for being with us. I'm Stan Hall. See you next time on Get in the Game. Goodbye.